With increasing patient expectations, it becomes increasingly important to deliver individualized component position and total hip arthroplasty. HIP7, a software-guided surgery system offered by Smith & Nephew, enables the surgeon to digitally measure cup aneurysm and inclination, leg length and offset, and also assess patient-specific pelvic tilt, and also provide a simulated post-op AP X-ray to give the surgeon qualitative information about what the post-op AP film will look like. The first step is to use TraumaCAD digital templating software to identify landmarks in the pre-op AP film. Those landmarks determine the individual patient pelvic tilt. At that point, we can export that plan on the day of surgery to the HIP7 navigation system. So in the HIP7 navigation system, we'll identify which side we're going to operate on, whether right or left, whether the patient is a male or a female, and what our surgical approach will be. Is it a lateral or a direct anterior approach? We also select our cup impactor, whether a straight impactor or an offset impactor. In surgery, I've placed two reference arrays, one on the iliac crest of the patient and another non-invasive reference array on the distal end of the femur. The pinless reference array is purely used for orientation of the femur and is not used to take measurements. The first step in the procedure is to take the ASIS points and digitize those points. So as I bring my probe, I'm going to digitize the first treated side ASIS and then move on to the contralateral ASIS. Now I've inserted a screw in the proximal part of the greater trochanter, the most lateral aspect of the greater trochanter. This point is used to digitize once before I've resected the neck and digitize that same point after I've resected the neck to check leg length and offset. Once I have the acetabulum exposed, I'm going to digitize points on the surface of the acetabulum to find the center of rotation of the patient. So I proceed and paint the surface in a zigzag pattern until the software indicates that I've taken all the points necessary to find that center rotation. The next step is to digitize the acetabular fossa. And with that, the registration is complete. At this point, we'll ream the acetabulum, and once we're completed with reaming, we'll insert the cup. So I'm going to take my cup impactor and insert it into the acetabulum, and then in the software I can visualize the orientation of the cup impactor in the acetabulum. So you can see on the screen we have on the left side, this is a view relative to the anterior pelvic plane, and on the right side we have a view relative to the X-ray plane of the patient. And you can see for this particular patient below, we have 11-degree posterior pelvic tilt. So my angles relative to the anterior pelvic plane are 41 and 17 degrees. With 11-degree posterior tilt, I'm at 42 and 25 degrees. I can also focus on different views. So if I want to take a look at just the anterior pelvic plane, I can zoom in on that view. However, a lot of surgeons will find that the X-ray view is very instructional. So we have our angles relative to the X-ray plane here. So if I'm targeting my 45 and 15 typical Lewinix safe zone angles, I have my view here at 44 and 15. And you can see that the cup looks pretty good there, how it faces out of the plane. So we have a simulated view of our post-op AP film together with our aneurysm and inclination values. At this point, we'll proceed with preparation of the femur. In that case, we'll broach the femur and insert our trials as normal. So now that I've got my trials in, what I want to do is take a look at the leg length and offset based on the position of those trials. So what I do is position the leg relative to the view, and you'll see on the leg length and offset screen that I have a target to line up. So what I'll do is I'll position the leg until the target turns green, and I can digitize the point. Now that I have a green target, I'll digitize that same screw. And then once I've digitized that same point that I took preoperatively or before I resected the femoral neck, you'll see that the software outputs the leg length and offset change based on the position of my trials. And with that, navigation in this total hip procedure is complete. The data from this procedure is stored to a patient report. And in this patient report, it is exported as a PDF that you can either give to the patient or keep for your own personal records. Navigation in total hip arthroplasty has been shown to achieve more consistent leg length restoration as well as more accurate placement of the acetabular component. HIP7 was designed for efficiency, allowing the surgeon to take control of acetabular positioning, leg length and offset, and also to consider pelvic tilt for the placement of the components for that particular patient. It also includes the simulated post-op AP X-ray, which gives the surgeon qualitative information during the surgery to consider what that post-op AP film will look like. Thank you.